class. My name's Anthony Nunez, as most of you probably know. I have been a very proud advocate of the fact that I am a father of 3 children. I have a young son and 2 daughters, happily married. So before I got into my project, I just wanted to give you guys a little background information on, my life and why this project actually kind of means so much to me. So when I first got married, it was on Christmas Eve, 2013. I was in the Marines, and shortly after our wedding, we found out that my wife was pregnant, and we're really happy about it. There was one unfortunate drawback, the fact that I was actually going to be deployed soon, so I wasn't going to be there for the birth of my daughter. By the time she was born, I was in Iraq, and shortly thereafter, I kind of got sick, got sent home, and I met my daughter for the first time. She was 3 months old, and I was in a hospital in Maryland. She was a really happy baby, really cheerful, always smiling. You could never really notice if there was anything off, She just seemed like a baby. But the older she got, the more we noticed that, something wasn't quite right. She didn't walk on time. She started with babbling, but it kind of drew back. So, the process has started the same as any normal child would. But we noticed that whatever progression she made, it kind of stopped, and it went backwards a little bit. So we got worried, She was already 2. She wasn't speaking. She wasn't walking. We noticed that she did a lot of self-soothing things. She would hum, she would clap, she would laugh when there was nothing to laugh at. And just a lot of things that were out of place. And we talked to our pediatrician, and we were like, "Hey, is there something going on? This is our first child, and we're worried. We have no idea what we're supposed to be doing, but we can clearly tell that something's not quite right." And the pediatrician's like, "You know what? You're right. We're gonna get her checked out." So they sent us to this program called Early Steps, which is through the University of Miami. They help with children with cognitive disorders, behavioral disorders, things like that. And they sent us to the Center for Autism, the Florida Center for Autism, and that was in the actual University of Miami College down in, I want to say, Coral Gables. When we got there, they did a screening, did a lot of tests, and they were like, we would like to inform you guys that your daughter has autism, right? It was tough, but because we caught it at a reasonable time, obviously we would have liked to have caught it sooner, but it happens. They were able to work with her. By the time our second daughter was born, they were like, "Hey, you should probably get her checked out too, because if one child has it, the likelihood of the next child also having it is very high." So we did, and it turned out that our second daughter also had autism, but on top of that, she also had attention deficit hyperactive disorder, ADHD for short. So, everything that she had with the autism, although it wasn't as strong as her sisters, because my oldest daughter, she's still nonverbal, and she still does a lot of self-soothing. It's just really hard for her to communicate, get into groups. Yeah. But the younger one, you know, she can kind of try to interact, but she throws really bad temper tantrums, and it's really difficult for her because on top of having the autism, she also has this uncontrollable hyperactivity and a very, very short attention span. So it, it, it's tough. It's something to work with. My daughters currently partake in ABA therapy, which is a behavioral therapy. We have therapists that come to the house, speech pathologists that come to the house, work with them, and stay consistent. Now, with that being said, now that you have a little background history on me and my connection with autism, I'm going to move forward and give you guys a little information on what exactly the disorder is. Now, as far as autism goes, it is actually a spectrum, all right? So the full name for autism is autism spectrum disorder, all right? It is defined as a neurodevelopmental disorder characterized by a deficit in social behaviorals and nonverbal interactions, such as reduced eye contact, facial expression, and body gestures for the first 3 years of life. Obviously, it's not just the first 3 years of life. It goes on even past that. You can get into things like, I don't know if you guys are on Netflix, but there's a show called Atypical, which shows the life of a high school boy and his, you know, his path living with autism. And I could tell that there's a lot of similarities between him and my daughters, because my daughter's 6 years old now, and she still deals with a lot of the key characterizations of autism. Okay. Now, it says here that the distinct social behaviors, including avoidance and eye contact, right? That is something that is so serious, right? Now, we as people like to connect, right? Especially when it's something important in life, okay? You're going for a job interview, maybe you want to get a scholarship, you need to talk to people, right? Eye contact is key, all right? Especially when you have to conform to social norms, right? So if you're sitting there, you're fidgeting, you're looking around, you're humming to yourself, you're rocking, people are gonna think there's something wrong with you. Which, you know, with autism, that it might be a disorder, but it's definitely something that you can live with. You know, you can move forward. People have this view of others with autism as being something so negative, and it really isn't. It is something that, although it is serious and something that wasn't really understood in the beginning, it is definitely something that, if caught early on and worked with, that you could even possibly use it to your advantage, right? There are people with autism that have something called savant syndrome, right? Savant syndrome is like, imagine finding one thing that you like, right? And you're really good at. Now, someone with savant syndrome is really good at it. Say like numbers, cards, right? They can calculate things in their mind without even having to use a calculator. Like, it's easy for them, right? Or, you know, maybe like the next Picasso, then they're great at painting. Or instruments, right? They can teach themselves how to play multiple instruments, no hassle, just by ear. Like, it's so interesting to see the way that works, right? For instance, my daughter's ABA therapist has told me that although my daughter cannot speak, she can read. And at 6 years old, you know, she reads and comprehends what it is that she is reading. And you can see that by the way she reacts towards things. Okay, so we have something called a PEX book. Okay, that means that there's pictures, there's words, and if she wants something, because she cannot speak, she'll go into her PEX book and she'll bring it to you, and it's like Velcro. And she'll rip off the picture and be like, "Hey, I want this." At first, it was a lot of her grabbing the pictures, right? But now it's gotten to the point where she'll look at the words, she'll read it, understand what she's reading, and give it to you like, "Here, I want this." It's great. It's really great to see that progress. You know, it's definitely something that we've had to deal with for a while, and it was really scary in the beginning. Now, we get on to the actual like diagnosis of autism. Okay, now as far as autism goes, I know there's a lot of like rumors now, like, "Oh my god, vaccinations are causing autism." Not true. Autism is a genetic disorder, right? That means you were born with it. And there's not much that is known about autism. Like, they don't really know how you get it. I mean, there is like a genetic factor, right? Say if it's in the family, that the likelihood of getting it is higher, but there isn't a wholehearted understanding of how people get autism. It is known that if there are siblings, if one child has autism, the likelihood of the next child having it is, you know, reasonably higher. As far as my children go, you know, like I said, my first two daughters both have autism, but as far as the doctors are concerned, my son does not show signs of it, and he is, you know, advancing as an infant does, right? He's been on track with just about everything thus far. He is 6 months old and he hasn't shown any signs. You know, with my second daughter, since we had already known the signs from the first one, with the second one, it was clearer to see, and even like early on, she showed signs. So take that for what it is. With the, you know, studies made, there have been different psychosocial interventions developed targeting both the core symptoms and the associated symptoms of autism spectrum disorder, right? Applied behavioral analysis, ABA, is a treatment based on theories of learning and operant conditioning, okay? That is the therapy that I had spoke about that my children are both taking at the moment, all right? Because there is no cure per se to autism, right? Because that's just the way your brain is built. And unless we find a way to scientifically, you know, change someone's brain, like do full brain surgery to where we reconstruct a brain, then there's gonna be no changing that, right? So the way that they work with it and the way that they treat it are these therapies, right? It includes specific intervention targets coupled with positive reinforcement, you know, verbal praise, tokens, or edible rewards, with repetition of learning trials a key component, all right? So that means there's levels to it. Once they reach a certain goal, they move forward to the next goal, and so on and so forth. It's something that takes time, you know, but the more you do it, the better they get at it. So in treating autism, you're not treating the condition itself per se, as far as you're treating the way that they react to the condition, all right? Because you'll never get them to fully understand social norms, but you can teach them to fake it. And those are the purposes of these treatments. Okay, so we're going to get started with, there are 3 different types of like impairments or behaviors associated with ASD, right? So you have qualitative impairments in social interactions, right? It is manifested by 2 of the following. Impairment in the use of multiple nonverbal behaviors, right? Eye gazing, facial expressions, the way you posture yourself. It is a failure to develop peer relationships, lack of sharing enjoyment, all right? So say you can be really, really happy about something and they'll look at you like, I have no idea what's going on right now. Lack of social or emotional reciprocity, right? So what that means is that, say you're really sad and it's like, oh, my dog just died, and they'll be like, so why are you sad? Like, it's a dog and it died, who cares? All right, moving on, we go to number 2, which are qualitative impairments in communication in at least one of the following areas, right? Delay or total lack of spoken language. Like I've explained with my daughter, who is 6, it was a total lack in the beginning. Now she can say a couple words, like she can grab an apple and be like, apple, but that's about as far as it goes, right? Marked impairment in the ability to initiate or sustain conversation with others. Now, that moves on towards like older children or children who have already gained the ability to speak. It's kind of like, imagine being socially awkward just at a higher degree, right? Like, you want to start a conversation with someone, you just don't know how to do so, right? And stereotype repetitive use of language or lack of varied spontaneous play. Now imagine they have like certain words that they say, right? And these words, it's like saying okay, right? Like, it's like, oh, can you do this for me? Okay, 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 okay. In their mind, like, they want to say it one time, they just can't. Like, it's difficult. Number 3, restricted, repetitive, and stereotyped patterns of behavior, right? Interest and activities manifested by preoccupation with one or more patterns of interest. Inflexible adherence to non-fictional routines or rituals, repetitive motor mannerisms, or preoccupation with parts of objects. That is key, right? So, for people with autism, they like to live by a strict routine, okay? They have a way of doing things, and they have this pattern, and they continue doing it over and over and over and over again. And if at any point that changes, that will disrupt their whole life, right? Total chaos, turmoil. They start freaking out, right? Because they're so used to everything being a certain way that the second that changes, they don't know how to react to it, all right? Now, as far as like the preoccupation with objects, that's pretty true. Okay, so my daughters, right, obviously girls, they love Barbies. My daughters, for some reason, have a thing with the shoes from their Barbies, right? They will walk around with these shoes everywhere. You can't take the shoes away from them because they will get really mad, but they have these shoes and they love these shoes. I know I said that therapy was the only way that you can treat autism, and that still holds true, okay? But I'm going to move into something called pharmacology, right? So there are medications primarily used for treating associated symptoms of autism spectrum disorder. As efficiency for use in treating the core symptoms of autism has not been established, Targeted associated symptoms may include, but are not limited to, irritability, aggression, self-injurious behaviors, anxiety, hyperactivity, impulsivity, inattention, and insomnia. That is something that I can really speak on. Now, as of right now, my children are not currently taking any medications. That's more of a personal choice. I'm not a big fan of medication, and it'll kind of hurt to see my children on them. But I know that it's going to be something that I'm going to have to do eventually. My daughters are both very, very different. So, as far as these different symptoms are concerned, each one exhibits some of the same and some different. For instance, my older daughter, right? She tends to have like the self-injurious behaviors. She'll take like pencils and pens and whatnot. She'll like dig it into her skin. You have to stop her. We're trying to teach her not to do that, but it's something that she does, and it's something that we can't really control. They both deal with high anxiety and insomnia and irritability. They do a lot of crying. They get bothered easily. It's sad, but like I said, each of these symptoms, for each child, it's different, and that holds true to my children as well. So, with that being said, I know I kind of went over on my time, but I hope you guys got a firm understanding of what it is to have autism and what it is to live in a family where autism is a major part of your day-to-day life. If you have any questions, please feel free to talk to me after class, or if you see me around, and I'll be happy to share my experiences. Thank you, and